What if I told you that the most common elbow injury in children is treatable with a few maneuvers that you can do right at home? This video is all about nursemaid's elbows in children, when to expect it, how to treat it, and how to prevent it from recurring. Hi everyone, I'm Dr. Eileen Shi, a board-certified pediatrician. I work holistically with parents who want a child-centered, integrative approach to solve their children's health issues. So, if that sounds like you, make sure to subscribe to the channel for more content just like this. As a pediatrician, the story I hear most often about an elbow injury kind of goes like this. My child suddenly avoids using one arm completely because of pain, and she's been keeping her elbow bent on that one side and not letting anyone touch it. There's usually no physical injury or falls that precedes it, but sometimes parents will say that their child was roughhousing with a sibling or someone had tried to pick up the child with one arm. Sounds familiar? Well, nursemaid elbow is very common in children 6 months of age to 5 years of age. Having asymmetrical, unequal forces tugging at the arms is the most common cause of this injury. This, as you can imagine, can happen when a child is pulled up by the hand or falls suddenly when being held by the hand. However, oftentimes there may be no obvious reports of these preceding events, but you should suspect it when a child suddenly resists moving his or her arms and holds it close to the body, usually with the elbow bent slightly. There are a couple medical terms for nursemaid elbow. Doctors may refer to as radial head subluxation, or more commonly as annular ligament displacement, which is to describe the slippage of this annular ligament over the head of the radial bone in the forearm. This leads to trapping and impingement of that ligament within the radiohumeral joint between the radial bone and the capitulum. And therefore, it is painful and tender at the elbow joint with any movement. One quick disclaimer, this video is not meant to substitute for an in-person medical exam or diagnosis. When there is suspected elbow pain, it's always important to ensure that there are no other hidden injuries to the bone, like fractures. Once fractures are ruled out and the diagnosis is most likely nursemaid elbows, then there are a few maneuvers that can be attempted to quickly and effectively reduce the displaced ligament back in place, even without further radiographic imaging. First maneuver, supination with flexion. Now, with this maneuver, you need to fully supinate the forearm with the palms facing up. Place your thumb directly on the radial head and hold your child's wrist or hand, followed by flexing the elbow. You often will hear a click when this is successful, but not always. This click can happen simply by fully supinating the forearm or anywhere along the maneuver as you flex the elbow and bring the hand towards the shoulder. Second maneuver, pronation with extension. This maneuver is just simply forcefully pronating the wrist with extension or flexion of the elbow. By the way, if you found this video helpful, please give it a like and subscribe to the channel so that you will be notified of future content just like this. Now, either technique is effective at reducing the displaced ligament and it resolves the discomfort and pain right away. But in real time and in practice, I often see a few minutes of hesitation from the child because he or she has been actively guarding that elbow so carefully that the child may initially still be just afraid to use that arm. So generally, just by giving your child a few minutes to play or settle in or focus on something else, I usually offer a toy or an object of interest to the child from the side that they're shielding. And this is when they often will just use and move that arm that was hurt without hesitation. Voila! Super satisfying to fix and can be attempted at home or anywhere when this is suspected. Just make sure, again, you are not dealing with any occult fractures or trauma to the arm, in which case this would be painful or not helpful at all. If you made it this far, thank you for tuning in. Nursemaid's elbow in children is common and it can be fixed fairly quickly and easily when these maneuvers are done right. In our Las Vegas-based practice, we work with families one-on-one, offering concierge individualized care to each patient holistically, minimizing the unnecessary pharmaceuticals and treating the root cause. To learn more about how you can work with us, click on Become a Member and fill out the information so that we can schedule a time to chat. Thank you all for watching, and see you next time as we navigate the world of holistic pediatric medicine.